causes of stomach cancer, and how to prevent stomach cancer. Many types of cancer are ravaging the world today, cutting the lives of many short. One of them is stomach cancer, also known as gastric cancer. Stomach cancer accounts for approximately 1.5% of all cancers diagnosed in the U.S. yearly. However, if not treated early enough, it can also spread to other organs, such as the liver, lungs, lymph nodes, and bones. This type of cancer can lead to symptoms such as abdominal pain, nausea, bloating, weight loss, vomiting, and bleeding in the stomach. According to the American Cancer Society, the United States expects about 26,500 new cases and 11,130 deaths from this type of cancer in 2023. Also, stomach cancer infection is usually higher in men, 1 in 96, than in women aged 68 or older. Furthermore, this disease has a 5-year relative survival rate of 36%, with different stages having a 5-year survival rate of 75%, with 35% and 7% for localized, regional, and metastatic cancer respectively. Causes of stomach cancer. The exact cause of this disease has not been determined yet. However, some factors can increase the risk of developing stomach cancer. The risk factors are detailed here. 1. Heliobacter pylori infection. This bacterium infects the lining of the stomach, causing inflammation and ulcers. Although this infection does not often cause symptoms, it is prevalent, infecting about 2/3 of the world's population, and can increase the risk of stomach cancer, especially in the lower parts of the stomach. 2. Diet. Eating too many salted, pickled, or smoked foods can increase the chances of stomach ulcer by damaging the lining. In addition, these foods can also contain certain chemicals that can alter the DNA of the stomach cells. Pickled is a method of preserving foods in an acid solution, usually vinegar or salt solution. Studies have shown that eating many fruits and vegetables reduces the risk of this disease, as these fruits and vegetables contain antioxidants and vitamins that help prevent the stomach DNA from mutation. 3. Smoking. Smoking tobacco products increases the chance of having stomach ulcers, especially in the upper part of the stomach near the esophagus. It can also damage the stomach cells, making them more vulnerable to H. pylori infection. Smoking doubles the chances of having stomach cancer in smokers compared to non-smokers. 4. Obesity. Being overweight or obese increases the chance of developing stomach cancer by increasing the likelihood of gastroesophageal reflux disease, GERD, in which stomach acid rushes back into the esophagus and irritates it. The esophagus and the upper portion of the stomach may become inflamed and develop precancerous alterations as a result. The risk of stomach cancer is around 50% higher in obese people than non-obese people. 5. Family background. You run a higher risk of getting stomach cancer if a close relative does. This could be brought on by environmental influences or inherited genetic alterations. A family history of stomach cancer affects 10% of those who have the disease. 6. Other circumstances. Some stomach-related medical disorders can increase the risk of stomach cancer, such as chronic atrophic gastritis, intestinal metaplasia, pernicious anemia, or stomach polyps. How to prevent stomach cancer. There are no surefire ways to prevent stomach cancer. However, specific steps have been known to reduce the risk of getting this disease. Some of these are: 1. Treat H. pylori infection. If you start observing the symptoms of this infection, such as indigestion or ulcers, you should see your doctor to get tested. Proper treatment of this infection with appropriate antibiotics will reduce the risk of developing stomach cancer in the future. 2. Eat a healthy diet. Maintain a healthy diet by consuming fewer pickled, smoked, or salted foods. Eat more fresh fruit and vegetables. Additionally, you must abstain from alcohol use, or keep your intake to no more than 1 drink for women and 2 for men daily. 3. Maintain a healthy weight. By eating a balanced diet and engaging in regular physical activity, you should attempt to stay within a healthy weight range for your height and age. Reducing GERD and other health issues could lower your chance of stomach cancer. 4. Refrain from smoking. If you currently use tobacco, you should stop as soon as possible. Your risk of developing stomach cancer and many other cancers and illnesses can be reduced by quitting smoking. 5. Get screened. You should discuss getting screened with your doctor if you have a high risk of stomach cancer due to a family history. A barium swallow is a screening test involving a liquid that coats your stomach, followed by a series of X-rays. Endoscopy is another screening exam that involves inserting a small tube with a camera into your stomach. These tests can aid in the early detection of stomach cancer when it is more manageable. Stomach cancer is a severe disease that can affect the quality of your life and even take your life completely. However, knowing the causes of this disease and taking conscious steps to prevent it can significantly reduce your chances of coming down with it. Following are references we used to create this video for you.